Today in Right Parenting Tips, we will present a complete family guide on the common seasonal viral infection influenza or flu. Influenza is an RNA virus, which can be spherical or elongated. It has different types and subtypes, of which A and B types are most problematic in humans. The infection spreads as droplets through coughs and sneezes, through air, and also through direct contact and contaminated objects. Every flu season, which in Northern Hemisphere, takes place in fall, winter, and early spring, globally affects millions of people and kills a few hundred thousands. Multiple flu pandemics have occurred over the years. Flu typically presents with fever, chills, sore throat, headache, body ache, cough, cold, sneezing, weakness and loss of appetite, and sometimes vomiting and loose motions. Flu can have deadly complications like secondary bacterial infections of lungs, sinuses or ears, inflammation of heart, brain or muscles, paralysis or worsening of chronic conditions. At risk for serious or complicated flus are babies, young children, old people, those with weak immunity and chronic illnesses, and those living in crowded confined communities. Most flus just need symptomatic supportive treatment with rest, plenty of warm fluids, fever medicines like paracetamol, and measures like saline gargles and steam inhalation. One should avoid taking antibiotics, strong anti-inflammatory medicines and over-the-counter cough-cold medicines in flu as they are mostly needless and useless, and potentially harmful. Antiviral medicines such as oseltamivir are sometimes prescribed in high-risk and complicated cases. Like COVID, influenza also can be prevented by handwashing, social distancing, face masks, covering coughs and sneezes, disinfection measures and vaccination. There are different types of influenza vaccines which are given seasonally to protect against serious and complicated flu. They are advised for high risk as well as general population. To summarize, influenza is a highly contagious viral infection that is seasonal, and with respiratory, and sometimes gastrointestinal symptoms. It can be serious and deadly in high-risk patients. Mostly it just requires supportive symptomatic treatment, and sometimes antiviral medicines. Vaccination is an important prevention against influenza.